can't walk my dog. I can't do anything, really.
And that's the home run. Stand up.
Oh,
Sit and stand.
Oh, man.
4 more times.
jeez.
Come on. Easy, Tiger. Easy, Tiger.
Welcome to the office.
Welcome to the office, sir.
Thank you, sir.
So we're going to talk about everything that's going on. What brings you here? Talk to me.
I don't feel good.
Okay.
And I want to feel the way I was feeling 6 months ago.
6 months ago.
Yes.
So what happened in the past 6 months?
I don't know. I felt it in September. It was just something right here on my toe, and I would step on it. Felt like like I had swollen or something.
Okay.
So I kind of brushed it off, and I soaked it in ice. It went away.
You felt that your toe was swollen.
Underneath.
Under the big toe here?
Right up. Yeah, it's still there.
So you feel it's swollen or painful?
Painful.
He's describing pain under the base of the third metatarsal right there on the bottom. You're actually right here. So this piece here,
Yeah.
that's right here.
Oh.
And you're feeling it shoot from here up to the back of the knee
Right here.
and into the butt.
And then it goes this way right here, like right now.
Okay, so
I
you're
feel
feeling it the
I'm
whole
feeling
way.
it.
You're feeling a pull, or you're feeling electricity, or you're feeling
pull.
a pull. Okay.
A pull with a little sting.
Okay.
And then once I get relaxed and I can't relax it, then it moves over and I start feeling it over here.
The same.
Not now, less, but it's there.
Does it go into your toe on the third toe?
No, it just stays right here,
Stops at the back of the right knee.
right here.
So it switches sides.
Yeah,
I
but it's
got it.
more so here.
Okay. And what
And then-
happened 6 months ago though? You did something? You
Well,
fell?
I went golfing. I remember
Okay.
going golfing the month before. We did 18 holes and I walked. I didn't cart. I just had my little bit and we were just having a good old time. And then that passed and working on my car, working on the house, and nothing major, nothing really. And that was the only thing I did. And then September, I felt that and it went away. I soaked it in ice, it went away.
Okay.
And then September went, and then I started feeling my low back pain without this.
Okay.
And I even asked my wife, I said, my back's kind of sore. So I iced it, and it went away, but it came back in days. And as it came back, it was like coming back more and more. And so I was kind of hiding it, and I was taking Advils and what have you, and then we got into September, and my legs started hurting bad, all right here, everything just bad. We came into almost December,
Okay.
and I started feeling pain in my hands,
Okay.
but no tingling, no numbness, just kind of like pain.
Mhm.
And then one night I was asleep, and it woke me up. It was just like tingling, and
Along the thumb and the index finger?
this one, and this one.
Okay. All right.
Both
hands?
All of them, both, yeah.
When we're looking at your L5 and you're looking at your posture, you can see what? You can see that your neck is anterior to your foundation, and we're going to talk about that significance in a second. If we start at the base here, go up here and take it to C2. That angle is what? 22.7. Let's just say 20 degrees to be easy math. For every degree we have anterior head carriage, for every degree forward, times that by 10. And that's how much extra weight we're carrying on our shoulders or the base of our spine. So it's like you carrying 200 pounds on your back, and that's more than the military. Okay, does that make sense?
Yes.
So those muscles are tight. Everything is stiff and tight because as if you're standing long periods of time or sitting long periods of time, you're feeling that up there. I know you are.
Yes.
Okay? And that's the reason why. So part of what we need to do is, can we get your posture to get things moving again? Does that make sense, sir?
Yes.
Okay, we're going to go over your foundation now. And when we're looking at your foundation, the first thing we need to do is, do we have a level base and foundation? And when we look at it, we're a little bit off. Okay, we look at the hips. Your hip sockets are still good, they're still decent, okay? Left one is worn out a little more than the right, but they're still decent. This is the crease of your bum and the pubic bone, and there's a little bit of a shift in your foundation in your pelvis. When we go through your SI joints, the right side I can see through, the left side we got some scar tissue up in here. We're gonna go to the numbers, and now this should make a whole lot of sense. And let's see what we got. Okay, so we have what's called an ASIN on the left with a rotated sacrum on the left side. We have a short leg right now, a measured difference of 8. If I can fix your left pelvis, I'm gonna get that to 3. We wanna be under 7 millimeter leg length inequality, okay? As long as this number, the AD, so the MD is where you're at right now, measured difference. Correction of the left pelvis, ASIN, it's up, follow my process. It's up and in. The sacrum on the left side is 14 millimeters. This started as an old tailbone injury. You've dealt with it over the years. Enough is enough. The body finally said no more. We have 2 millimeter drop on the right side of the tailbone. The whole point of this is you have a rotated sacrum on the side of an ASIN. That's what's causing all this stuff going down your leg. And the sacrum being rotated, we said those sacral nerves, right? Look, we got nerves that come out.
Yes.
This is an old tailbone injury. This is a rotated sacrum. I'm not gonna ask you what did it, because you've done a lot of stuff. The point is that's what we have. When we look at the tailbone, you can see, we have a bend here. It's a slight bend.
Yeah.
I'm gonna zoom out a little bit so you can see better, okay? And ma'am, you should be able to see this too. So we have, from here, we have a little bend here in the tailbone. It goes like this, and then like this. So it bends. So whatever happened in those old injuries, this is all way back when, back in teenage years and 20s, whatever it is. The good news is, if we can get this corrected, the left pelvis, we get this under 7. Even if I can get it to 5, anything under 7, things are gonna hold a lot easier. Does that make sense?
Yes.
Okay, so when we're looking at the tailbone, should be a smooth curve. There's that nub, one nub. So this is probably where I'm gonna start, number 1, down in the tailbone here. If I look at your L5 disc, okay, the shape of that disc, that's at least a 25-year-old injury. So once we get this sacrum sorted out, then we'll talk about if we want to work on everything else for you, but your foundation is key. But your disc is still good, okay? It's less, but it's good. 4 is good, 3 is tilted back, 2 is tilted back. This is an old compression injury, but still good discs. Here's where the body starts to fuse. You see that?
Yeah.
Okay, that's fusing, that's fusing. That's from instability. And remember, I just talked about defense mechanisms. Let's continue. Discs are fine. Now let's get into the neck and talk about what's going on here. When we look at the neck, you follow me so far, sir?
Yes.
Okay, so when we're looking at the neck, we have that anterior head carriage. You have more of that straight military spine. Okay, it's not a bad thing, it's not a good thing, but we want more curve. Your disc is a little worn out here at C2 more than normal. 3 is good, 4 is good, 5, this is an old injury. 6 is still good, 7 is still good, but they're a little bit less. I'm gonna go through flexion, extension, or motion x-rays right now. Remember, you had to bend forward and back, and hopefully we're gonna get an answer right now. So this is your neutral, this is extension. You don't have a lot of extension there. Going back. And here I think is where part of our answer is. When we go in flexion, C2, C3, C4, C5, C6 didn't move. C7 moved a little bit, but C6 is your old injury. It's some sort of old whiplash injury you had at 5'6". You see the shape of that bone? It looks smaller, it looks different from the others. They should all be the same. I'm gonna change the contrast. You can see it maybe a little bit.
Wow.
You see it now?
Yeah.
You see how it's wedged right there?
Yeah.
So is 5. Now let's go in flexion. Let's change the contrast. Okay, now you should be able to see it better. These discs are good up here. That one didn't move, that one didn't move. That's your C6. There's a lot of scar tissue in there. C7 also didn't move. So the answer is somewhere in here. It's either 6 or 7, okay? Does that make sense so far?
Yeah.
Okay, let's continue. So we have some curvature issues. We have this area here, instability, and now this is what we need to talk about. All of this, I'm not fixing that. But if I get the body stable and get you moving, you may get pops and cracks you didn't have before. That's the body trying to readjust itself.
Okay.
Not the areas that I'm breaking up. I'm not breaking anything. Okay? Now, let's continue. When we get to this area, the upper back, we're not going to be able to fix the neck unless we can stabilize this upper part of the body, T1, T2, T3, T4. So this is calcified, this is calcified. T3 kind of shifts to the side, T2 shifts to the side. So whatever's going on here, we're going to need to stabilize. All of this is secondary to the foundation. Does that make sense?
Yes.
Then I can deal with your extremity, shoulder, elbow, wrist, as you've seen me do with people. But the power comes from here. The power comes from here. Okay? Make sense?
Yeah.
All right. Turn around, keep walking. He's got a very stiff gait. Keep walking. As you're walking, where's the pain, sir? Both legs?
Yeah.
Okay, let's watch here. He kind of just goes side to side, right? This is kind of his walk.
He's avoiding pain.
Okay.
He doesn't.
How long you guys been married?
Oh, 18 years.
Right now. Keep walking. You got a little bit of that Duarte shuffle going on there. You got a little bit of that shuffle. Keep walking. All right. You can see the swelling in his hands. He's got
No,
a
they've
lot of
been
swelling.
worse.
It's a lot of swelling. And they ruled that there's no infection in his body, right?
No.
There's no infection.
I have his medication.
Let me see here. Starting at the base. And we're getting 17, 18 points, 15 points. It didn't stop at C6 though. It goes all the way up to C1 on the right. Let's see what we got this way. Now he's telling me both hands. Both hands, he's got a lot of layers going on with him. So we really need to figure out where we're gonna start. T3, left side. T3, left side. And then it switches again. And now it switches again. So guess what my suspicion is, guys? We gotta start on this foundation. Things are gonna be shifting. He's compensating a lot in his body. Now it's 5 points at T2, T3. Mid-back is okay in terms of pressure. All of this is starting down low, right there. Let's do that again. And these are old injuries, so 5 points, that's S3. I'm not expecting big, huge breaks down here. And the reason why is the older their injury is, the smaller the break is. So we gotta hunt it a little bit more careful. That's S3, S4. Make sense, sir, what I'm saying?
Yes.
Cool. I'm getting the penthouse in the basement, dude. Yep, I'm getting top and bottom, I'm getting T2. I know the fix is gonna be somewhere in here, but that's not where we're starting. Let's statically palpate and see what we got, starting at the base. As we statically palpate, you can see the swelling starts here, right around that T2, T3. Tender there, sir. You okay there?
Yeah.
Okay. Goes down, swelling, so the whole thing is swollen the whole way down. All the way down into the tailbone on the left side. If we go on the right side, starting here, same thing. Swelling all the way down, all the way down. Pulls more here, and then it starts to disappear in here at the tailbone. Okay, next thing, head down a little bit, this, head down.
Head down.
That's fine. That's 6, that's 7. 1, 2, 3, numero 2. More pain at 2, yes? More at 2, more at 3. Which one hurts more? Number 2
2.
or number 3?
The
Both?
same.
Not 4.
Not 4.
Number 3. Let's check the movement in his pelvis. Scoot forward a little bit, please, sir. Feet together. Left side only. Open the left. When he does the left, the right is fine. Right side only. Does the right. The left is actually okay. This is starting at the tailbone. Scoot back for me, sir. Okay, now let's figure this part out. This is the fun part. Number 5. S1. S2. S3. S4. Yes. Come back here so you can see this. Sorry, dude. You okay?
He's
I'm
in
sorry.
pain, a lot of
Sorry.
pain.
Give him a second.
Yeah.
Give him a second. I'm sorry.
Oh.
I'm right here, dude. I'm right here.
And he's on the phone.
You're gonna be okay. Was that the S4 that did that?
I think it was, I'm not sure, I don't remember, 3 or 4.
Bear with me. Bear with me, dude. We'll get through it. Bear with me, we'll get through it. And you wanna have a seat. And you wanna. We'll get through it, dude.
It's just pain, you know.
I think what we're gonna do then is we're gonna start at the upper cervical, get some pressure off the spinal cord, and then come back to that, okay?
Oh, I felt that way.
I felt that too.
Yeah.
We're gonna do a C2 on the left, really light, and then set his atlas. Look up. There. Nice and easy, boys. Look at that. Gotcha.
Oh.
Hold on. Get out of sight.
Wow.
Wow.
Wow, wow, good, yes.
Chicharrones.
Chicharrones. Caminar, por favor. Mira. Wow.
A little bit, watch your step.
Feels good.
Lighter?
Yes.
Good.
Oh,
Good. Walk a couple times. You walking a little
Yeah.
different, Jim?
I feel something here, but I'm not sure what it is.
What do you mean you feel something? You feel more pain?
Less pain,
Okay.
but I don't know.
That's right.
Everything connects, talks.
Keep walking a couple of times and then we're gonna recheck everything. That's pretty good. Am I hallucinating or he's walking a little
Yeah,
better?
he is, a little quicker too.
What you think, man?
Higher on your neck, I mean, your shoulders back,
We gotta get his swag back.
yeah, cause he
Talk
was,
to me, dude.
Feel good.
Good. I didn't touch your low back.
yeah, he didn't even touch it.
You know, I gotta be careful when I talk about that sciatica story,
Yeah, oh,
you know? No, I mean upper cervical. We didn't touch his back yet.
oh, yeah, we
And his
haven't.
back's feeling better.
He's
what do you know?
walking taller a little bit and,
What's a chicharrón?
yeah, chicharrones.
What's a chicharrón?
Okay, he's,
Siéntate aquí, por
all
favor.
right,
Head
we'll
down.
get there, baby, little sections at a time.
neck is clear. That changed T3. It's a little pressure on the opposite side, so we're not messing with 3. That cleared up. No stink. And now it's 5 points right there. Sir, I have to do the same test in your sacrum so you can feel the difference. You bear with me, okay?
Yes.
Don't elbow me.
No.
All right. Back slowly. Mira. Número 5. Diferente.
Yes.
S1. Mira. Diferente.
Yes.
S2. Mira.
Little bit.
Diferente.
Diferente. Yeah.
Número 3.
Yes.
Chicharrón. Número 4.
Rupa.
Rupa. Wepa!
That's it. Whoopa.
We didn't even touch it yet.
Oh,
What you think? It's there, but it's different. See? You can handle the adjustment now down low.
Okay.
Talk to me.
I'm ready.
You can do it?
Yes.
Bueno. Rotated sacrum on the left, down in S3, S4, with a slight little clockwise torque. Número 5, número 1, número 2, número 3. Bueno. Relax the shoulders, brother. There you go. You good? Senor. And that's the home run.
Gotcha.
Oh, sorry, Chacha.
Are you okay, babe?
Yeah, that's what he came for.
Yeah.
That's what he came for.
Oh my God, just.
Hold my hand, sir. Hold my hand. Hold my hand. Step off. Step away from the vehicle. Hold my hands. Raise them up. Raise them up. Raise them up. Come over here. Raise them up. Raise them up. Good.
Oh, jeez. Couldn't do that before.
Slide over here. Do the shuffle. Side shuffle. Side shuffle.
Side.
Raise them up. Raise them up. What you think?
A little sore, but
But you can do it.
yeah.
Walk for me now, sir. Check it out.
That's amazing.
Yes.
You're getting there, man. You're even walking
Yeah.
more normal
wait
instead
till-
of that pain lobbing.
Dígame.
The
What's
sitting,
up?
the sitting down, it'll go away.
Let's see. Sit and stand 5 times. We just started, sir.
Yeah.
Stand up.
Oh,
Sit and stand.
Oh, man.
4 more times.
Yeah.
Come on.
Right.
Easy, tiger.
Yeah.
Easy, tiger.
look at that.
And, yeah. I mean, he would just hold and almost collapse back down because he couldn't hold
I can enjoy life.
himself. It's a start, babe. Just,
Let's start 1 day at a time.
yeah.
okay? 1 day at a time. Have a seat. Let's continue. Bueno.
Yes.
That's 3. Bueno.
Yes.
That's 4.
Yes.
Now you get the buff and polish.
Well,
Vibration therapy. So have a seat, sir. Now the fun part. This is breaking up scar tissue, okay? Give me a second here. Easy, Tiger. Let me do my job. Scoot back for me, please. Scoot back. I'm doing your shoulder lightly. That's it. That's it. On your back. Boca arriba. Turn to your right side, please. Look how much easier he's gonna move.
Yeah.
Check it out. Yeah.
he couldn't move or
That's the
find
heel.
himself or sleep.
Other side, please. Da-da-da-da. Da-da-da-da.
Yeah, I know. You couldn't even.
think, man?
Oh, yeah. What a change, what an improvement. He feels good. Just seeing him move. Before he'd be stiff, walking like a old man.
But the third digit is gonna come off of the second cuneiform right there. So we don't need to touch the third metatarsal base. We need to go to the second cuneiform.
Okay.
2, 3. Mira. Aquí. Ooh, it's already moving.
Good.
Wiggle your toes. Wiggle your toes. Da-da-da-da. Mira. 1, 2. Diferente?
Yes.
Watch this. Come on up. Take your time. Don't mess up my work. Look at that.
But
So, there's something
hint.
on the toe.
Better?
I guess it'll go away as I walk. Keep walking.
I just repositioned a bone that's gonna affect that. So what I did was this, dude, check it out. You're complaining of the third toe right here, right?
Yes.
But I was finding this second cuneiform, this piece was up, so I set this back down. That affects the whole digit. So now it's gonna find its happy place, but the last thing I wanna do is let me machine the bottom of your foot. Go on your back, boca arriba. Just to break up the scar tissue, because you've been like that for a minute.
I'm just still amazed with this.
I know, you couldn't sit up. Get up.
Go ahead. So all this, I'm feeling is just gonna go away.
I hope so.
Yeah.
The whole idea is what? We just got things started for
Yeah.
you. We just got the power on. You've been like this for a long time.
That's right. Wow.
Okay? Just walk. Just walk.
It's like I can breathe.
Just walk, baby.
Come, just
Running.
walk. Come over here now. Stand over here, please. Squeeze my hand. Check it out. Okay? Squeeze.
I can squeeze a little more.
A little bit more. Relax there. Relax there. Little bit. Little bit. Little bit. That's it. That's it. Little bit. That's it. Alright. I don't want to do too much here, okay?
Yeah.
We want that power on first from the neck. That's it. That's where we're going to start, sir, okay? There you go.
Hey.
Squeeze.
No, I want to shake hands.
You can shake. Hold on, a little bit more. A little bit more. Go like this 5 times, best you can.
That's it.
That's okay. Best you can. Squeeze again. Let's try. I'll take it for first visit. Welcome to the office.
Yay.
Thank you.
You're welcome.